Bismillahirrahmanirrahim. Assalamu alaikum. Starting with the name of Allah, who is most merciful and the most beneficent. Starting with the introduction of the AHP Expertise, which is a platform solely work for allied health disciplines promotion and in providing guidance to students respective of their specialty. Now, AHP Expertise present a questionnaire session, so it's a golden chance for orthotics and prosthetic students to let their all queries answered by a very experienced and talented allied health professionalist, Mam Mujahida Islam. She completed her 4 years of professional career at Rawalpindi Medical University. Then she completed her MS with the pilot studies using assistive technology, rapid by WHO. She represented ICRS at 10th Annual Public Health Conference, highlighting the impact of physical rehabilitation. So warmly welcome you, ma'am. Please come forward and answer the queries.
Thank you so much, Hira, for inviting me on this forum to resolve the queries students are facing within this field. I would like to start with the very first question which you have asked. That was that the opportunities available in our environment or in Pakistan after completing a BS degree in prosthetics and orthotic sciences. I would say that opportunities are not always lying within a plate. Like nobody will come and present you the opportunities within the plate and you will take the opportunity and enjoy the opportunity. Opportunities are always there, but they are hidden. And for every person there are different kind of opportunities, different type of forums, different type of fields where they can flourish, where they can give their best. I can't exactly say that every person is meant to be made for clinical side or the clinical aspect or to pursue within the clinical aspect. Everybody has its own kind of potentials, capabilities, and capacities, and they have to find out that what area or what domain is best for them, or they can give their best within that domain. So orthotics and prosthetics is basically a very not a very new, but new within the within you can say the job structure. Within Pakistan, basically we follow gazetted uh, job system, which is defined by the government, and it has defined you can say career pathway. Like if after graduation, if one person is getting a basic pay scale job of 17 scale, and there will be an opportunity after 5 to 6 years that he will be promoted or to grade 18 and grade 19 or maybe 20. So within orthotics and prosthetic sciences, within Pakistan, the job structure is not, it is there, it exists, but it is not that much, you can say, stable. Within Pakistan, you have opportunities within the government sector, although they are very rare or specific or very limited, but you have opportunities within the government sector. Like recently, government of Ministry of Human Rights have announced posts for prosthetists and orthotists, and they have appointed all around 2 to 3 prosthetists and orthotists on the field on those posts. So the opportunities do exist, and more will come, obviously, inshallah, after the development of the sector. And within the private sector, obviously, you have multiple opportunities. You have multiple opportunities within the private sector, but I would say that the world today is moving towards entrepreneurship. So why to be an employee of someone, and why to be an employee of any government or any private organization? Why not to become an entrepreneur, to be an employer? Orthotics and prosthetics is a type of you can say, medical field which can be pursued independently within your within just completing 4 years of your degree program, and you can, that could be more, that can help you to earn as well, and to serve within the community as well. You like within private sector, multiple clinics are running within, you can say, within Rawalpindi, Islamabad, Lahore, and in each and every city of Pakistan. So the career opportunities are not less. You just have to scratch the opportunities, you just have to scratch the frame, and you have to grab the opportunity for yourself, the opportunity for which you are made for. The opportunity, like if you are not a person who is not good at giving clinical services, maybe you are a kind of person who is more good at administrative side, who is more good at management aspect, who is more good at research domain, who is good at you can say academics. So every person is not meant to be for clinics. So you just have to explore that for you which opportunity is the best, and you just have to pursue within that area. Uh, Saying that the opportunities are not less, I would give an example of many of my class fellows, many of my juniors, and many of my seniors who are successfully running their own clinics within different cities of Pakistan. Because orthotics and prosthetics is a kind of discipline which does not needs any, you can say, certification further, or obviously further studies will enhance your knowledge, will give you a wider aspect or wider spectrum to understand the field, and to understand the anomalies and congenital anomalies with which you are dealing with. But after doing BS degree, you can successfully run your own setup within any of your neighboring area. And I would not say that if a person is not having that much resources that he or she can run his or her own clinic, you can go for a partnership, public-private partnership or private-private partnership, which we can easily see within the normal settings. Like in Shifa International Hospital, there is a collaboration of Shifa with Child Foundation, and Child Foundation is running their prosthetic and orthotic clinic within Shifa International Hospital. That is basically uh, that is a partnership between the Shifa International and Child Foundation. Both the organizations are running their prosthetics and orthotic services. Shifa is offering orthotics and prosthetic services for the patients who are coming to Shifa, and Chal is basically offering the expertise. The persons they are which are providing the services are hired by Child Foundation, and the devices, the fabrication, and the whole process of fabrication is and the equipments, everything else is provided by Child Foundation. So there are examples that do exist, which are a very good example to take. You can take the inspiration from. So there are multiple other examples as well. So if you are done with your BS, you can go for your nearest orthopedic clinic, or maybe you can go to the nearest hospital, a tertiary care hospital, in which all the services or clinical orthopedic services are provided. You can go for a proposal with you, and you can give a proposal to them that you wanted to provide clinical services in orthotics and prosthetics area domain, which are not available within your hospital, they would I would strongly I would strongly say that they will agree, they will agree with you, and they'll provide you the forum to start your clinic with them, and you can easily provide services by services to the patient that will be referred to you from the orthopedics department, or maybe gynecological department, or maybe the pediatric department, because orthotics and prosthetics is not confined to a specific type of patients. Or prosthetists and orthotists is dealing with the patients which are coming from any department, like the anomalies which could be congenital and they could be acquired as well. So patients would be referred from orthopedics, from pediatrics, from maybe uh, gynae and obs. So there are opportunities, and there is but just you just need is the eye, and you just have to find out. You just have to scratch the opportunities for yourself. Um, I guess that this would satisfy the first question, the first query of the first question. Then I would come towards the second query, that was that what are the subjects, or what are the subjects in which you can pursue your academics after doing your BS. So in this question, again, there are two different domains. One is the clinical aspect, and the other is the management aspect. The first one, the clinical aspect, I would say that if you want to pursue within the clinical aspect, your clinical area or clinical field, you should go for, or you should opt the research and innovation. Research and innovation. Today, the world is progressing more towards the research and innovation area. With the research and innovation, you can get better treatment plans, you can get innovative treatment plans, you can get innovative ideas, you can get innovation within the devices. And with the research and innovation, you can give a different type of treatment option, a different type of treatment plan to the patients, which are to the patients and to the all the practitioners who are just following the conventional methods for the treatment of that specific deformity. So I would say that research and innovation should be the strength if you want to pursue within the clinical domain. And if you want to pursue within the management side, then there are multiple opportunities as well. So within the management aspect, the most opted field is MS in public health. MS in public health, what MS in public health is? Public health basically is an upstream intervention. So you will say that what is an upstream intervention now? Upstream intervention is basically to see the picture from the other side. Like in orthotics and prosthetics, we are dealing with disability. So the orthotist and prosthetist is doing his job or her job to deal with the disability or to treat the disability, to give the best treatment plan for the disability. But the other side of picture says some other story. The other side of picture says that what is the reason of disability? What is the reason that is becoming the cause of disability? So the to see the picture from the other side is the upstream intervention. Like treating the disability is obviously is a downstream intervention dealing with the specific problem that if a person is having clubfoot, so how to treat the clubfoot, or when the child is having pes cavus or pes varus or pes valgus, how to treat with how to treat that disability. But the other side of the picture is that what is the reason that is causing this disability to occur. Either folic acid deficiency or then mothers is causing spina bifida, either lack of accessibility to polio vaccination is causing post polio paralysis, or what is becoming the cause of disability. So that is the other side of the picture. And if you are opting the field of public health, you can see the other side of the picture. You will be having the capabilities to see the other side of the picture. You can work on the upstream interventions, like how to rule out the cause, and then how to manage to eradicate that cause, uh, so that you can control disability. So MS Public Health is one option. Then the other option, many of the students are doing their MS in hospital management. They are doing healthcare management and rehabilitation, MS in rehabilitation sciences, and within clinical field. Unfortunately, I would say that Pakistan, there are sorry, there are not much universities which are offering MS within orthotics and prosthetic sciences, but still, there is a university which has recently started their MPhil in prosthetics and orthotic sciences. That is ISRA University, and and I guess they have almost around 20 people, 20 or 30 people who have post graduated from there. So there are opportunities, and specifically if you want to pursue with your career within the field of prosthetics and orthotics, you can opt MPhil prosthetics and orthotics, and um, and the other very good option, very great option, that is that MS within biomedical sciences. NAST University is offering biomedical sciences, MS in biomedical sciences, and that is a research oriented degree, and that is a very great opportunity, I would say. Many of my colleagues, many of my class fellows, many of my juniors are enrolled within that degree, and some are done with that as well. That is basically a research oriented degree. And if you want to pursue within the clinical aspect, that is a great opportunity for you to opt MS in medical sciences and biomedical sciences from NUST, because they give you an option that you can opt prosthetics or either orthotics as your major, and you can do your you research work within within that area. Like one of my very good friend did her degree within biomedical sciences from NUST, and her research topic was to assess and to evaluate the pressure areas of transtibial stumps. Within transtibial stumps, she used pressure sensors to evaluate that how much pressure a stump is casting on the socket, and which area is pressure bearing, and which area should be like less pressure should be given to that area. And that research will I would say that in near future that can give her a very good opportunities if she will advertise, or she will launch her product within the market. So NUST is a very you can say a great name or a great university to uh, to opt your MS degree with. And within the other side, I have, as I've already said, that the other aspect is the management area. The management side, there are many very there are many universities and institutes which are offering MS public health, and I have studied my MS degree. I have completed my MS from Health Services Academy that exists within Ministry of Health Services Coordination and Regulations, and one of the best institute, one of the best institute, I would say that. That is one of the best institute to opt if you are going to opt public health. That is one of the best institute that should be your choice. There are many other institutions which are offering public health, like Shifa School of Public Health and their Khyber Medical College within Peshawar, and University of Health Sciences in Lahore. There are many universities which are offering MS within public health. So you can't say that you are within that there is a closed end after BS orthotics and prosthetics. There are multiple roads you can drive your car on. So next question was that what are the areas an orthotics and prosthetics student should focus on? Um, I can't suggest a single subject to focus on because every subject is interlinked with the other one. If a patient comes to you and you have to make a diagnosis and you have then to make a treatment plan for that patient, and then you have to fabricate a device for that patient, and then you have to deliver that device to that patient, these all steps consumes your knowledge from all of your subjects you have studied within your BS degree. Like anatomy, you will be when you will be examining the patients, you should know your anatomy should be strong enough that you can make a diagnosis. And your examination, your clinical orthopedics, if your clinical orthopedics will be strong enough, you can only make the diagnosis easily with the patient, and you can evaluate that what is the anomaly this is, and what are the muscles which muscle is weak, either there is a nerve injury, or either what is exactly the issue is which is causing this which is causing this anomaly. And only then you can make a treatment plan. And then the device fabrication, only you can do the best device fabrication when you will be having a strong hand on orthotics and prosthetics, and you can deliver a best device to the patient if you have strong your biomechanics will be strong, your biomechanical knowledge, and your orthotics and prosthetics area would be strong enough that you may know that if you will give pressure over this area and release this area, only then you can correct the deformity of the patient which you are treating. So there is no single subject which can make you a good professional. You have to be good within all. um, next question was that um, what are the opportunities available abroad for studies, and there are multiple universities which are offering all over the world, which are offering MS or BS as well. The nearest option I would talk about, the nearest and economical option is Thailand, universities within Thailand and universities within Malaysia. University of Malaya is offering post-graduation degrees within prosthetics and orthotic sciences, and they are quite economical. They have a very economical fee structure, and if you want to opt your post graduation within orthotics and prosthetics, that is a very good option. And then I would talk about the Mahidol University, that is in Thailand. Mahidol University in Thailand, that is also a very economical because they are the nearest options available for post graduation in orthotics and prosthetics field. While within the rest of the world, there are many other very great universities, great names, that Telford University and La Trobe University in Australia. And I have worked with La Trobe University while we were working on the curriculum, a unified. We were working on a unified curriculum for Pakistan for BS degrees in prosthetics and orthotic sciences. Unfortunately, that is stuck within the pipeline, but I hope in the near future that we will recognize from AHEC that unified curriculum, and then all over in Pakistan that curriculum will be used, or that curriculum will be the symbol of the best knowledge delivered to the prosthetic and orthotic students. So you have opportunities all over in the world. You can there are multiple scholarships now. Different embassies are offering now. Japan embassy is offering scholarships for students for post graduation, and plus European scholarship is now available within the market, and many of the students have just get that scholarship from the European sorry, European embassy. So, so you have, I would say again that you have to scratch for your own self. You have to scratch the picture. You have to scratch the scene, and you have to look for that. What are the best opportunities for you? And you just have to grab that opportunity and walk along the road. I forgot the next question. Can you please help me, Hira?
Yes, ma'am. The question is what should be our focus subject in this field? I think you already answered this question.
Yes, I
The
have.
other question is how practically this degree works in community. What is the significance of its practical aspects?
Sure. Um, that is a very what you can say, that is my favorite question, because orthotics and prosthetics is actually the field which is dealing with disability, and disability is the name is an area where you are treating with the disabled population, the people who are differently abled, who are made by Allah Ta'ala Subhanahu wa Ta'ala, and they have their weakness within, they have some kind of weakness, and you are treating with their weakness, and you are trying to make them capable enough to overcome that weakness. So prosthetics and orthotics is doing a great input within the society. Like if a person who a child who is born with the clubfoot, and clubfoot is a congenital anomaly, and if it is not treated, your child will be grown up with the with that anomaly. And the orthotist and prosthetist is the person who is treating, who is basically providing the treatment plan to that child, so that his or her feet may get corrected, or may get the anatomical position back, and can walk on his or her feet again. So I would say that you can't even imagine that what is the feeling when you can see a child, when you'll see a child who comes to you with the anomaly, and he got successfully treated by you, and then he comes to you walking on his or her own feet. What is the feeling that you will have after seeing that patient walking on his or her own feet? The same is the thing with the prosthetic patient, a person who got his limb amputated after either an accident, or maybe because of diabetes, or maybe because of any pathology. And when you give a prosthetic limb to that patient, and then when that patient will walk in front of you within the walking frame, the feeling that patient will have after standing on his or her own feet again, and the feeling that will be within your mind after seeing that patient walking again, that can't be explained. So I can't so you can't say that prosthetics and orthotics is not giving anything or not adding to the society. You are adding You are adding life. You're adding, you're giving, you are not doing less than anyone. You are giving life back to a patient who has lost his or her limb, and then he is capable enough to walk again. That that could not be explained. That could not be explained. So I would say that orthotics and prosthetics is doing enough, or that is doing great within the field of medical sciences.
Okay, ma'am. Next question is about elaborate the information on dental orthotics and the role of
Prosthodontics.
prosthodontist.
Yes, Hira, that is totally a different domain. And orthotics and prosthetic sciences is basically concerned totally with the congenital anomalies or the acquired anomalies of the musculoskeletal system. So, prosthodontics and dental orthotics is a different field. It's a very separate field. We are just dealing with the musculoskeletal anomalies, musculoskeletal deformities, and musculoskeletal deformities which are acquired or either which are congenital. So they both are different domains. Don't mix up with them.
Okay, ma'am. Next question is can we do this degree in sport field?
There is is a subject within orthotics and prosthetics BS degree that is sports medicine, and obviously, there is an opportunity to pursue within sports medicine. If you want to pursue within sports, then you can go for a degree within MS within sports medicine. And currently in Pakistan, I don't think so. There is any university offering sports medicine, but within abroad and within other universities in the world, they are they are offering MS within sports medicine. You can go for that degree, and then you can practice within the sports area.
Okay, ma'am. Which university offer higher studies in this field?
I have told this before that there are many universities. I have mentioned Mahidol University within Thailand, that is very economical as well. Their fee structure is quite good, and there is University of Malaya within Malaysia, and there are Salford University, and there is La Trobe University within Australia. Many universities there. You can take admission within and pursue within post graduation studies.
Okay. Is there any BPS 17 or higher jobs available after this degree?
Yes, I would love to answer this question that within our setup, within our society, the symbol of success is basic pay scale 17 job. But I would say that this is not the end of the world. Obviously, basic pay, a gazetted job within the government sector is beneficial for you because then after getting that job, you just have to work on your position, and then after retirement you are getting stipend lifelong when till a lifelong stipend you are getting after your retirement, and the allowances as well. But the basic pay scale job 17, of grade 17 is not the end of the story. If you are not getting that job, it's not the end of the story. You can make your own pathway. You can make your own. You can write your own story with your own pen. And so, if the question was that is there any job available within Pakistan of gazetted pay scale 17? So yes, I would say yes. As I have told you before, that recently within I guess it was October, or it was October 2020 when two positions were offered within federal by federal government, and they were in Ministry of Human Rights. And one of a very good friend of mine has got that job, and after successfully clearing the test, the exam which was conducted by the federal government FPSC, and then clearing the interview, and she is now working on that post. So there are jobs. There are rare. They are rare. They are rare, but they do exist. Like within FATA, KP merged areas, there is a defined you can say, job structure for the prosthetists and orthotists. Like I am working with ICRC, and they are working in collaboration with the KP merged areas, FATA, Kotal and Bajor, and they have defined job posts for prosthetists and orthotists. Even some prosthetists and orthotists are now working on grade 19 and grade 18 as well. So there are jobs. There are gazetted jobs available. Unfortunately, I would say that within Punjab government or within Sindh government, they are not announced yet, but they do exist. Their job structure is defined. They are not announced yet, but I hope in near future when they'll be educated within a nice manner, or when the government will acknowledge the need of an orthodontist and prosthetics within within our setups, they will sooner announce those posts.
Okay, ma'am, what is the procedure for applying abroad after doing graduation in this degree?
Hira, I would like to mention that there are different procedures for different universities, but the basic procedure is the same. That you should have your degree attested by HEC, and the rest procedure. Every university has their own procedure and their own methods of applying within those universities. Many of our juniors are have opted scholarships and admissions within abroad. One of I would like to mention one name. She is Badrunisa. She was, I guess, 2 years juniors than me with an RMU, and she is doing some research-oriented degree, research-oriented degree within prosthetic sciences. So every university has their own criteria and their own steps of applying. So I guess you should explore yourself if you want to pursue.
Yes, ma'am. Next question is how to do research in this field?
This is a very simple question. The research, the question, the question is actually when a child is of you can say when the child is of 6 months, or maybe less than that, many of the questions comes in the mind of a child. Like a child grabs different things in his or her surroundings, and then he or she wanted to know that what it is, and what is the shape, and what it is meant for. So within prosthetics and orthotics, you can opt for research by obviously by answering by you want to get the answers to any of the question within orthotics and prosthetics aspect, that will be the research. Like if you are working within within clinical area, and you wanted to know that every thousand live births, one patient is going to have clubfoot. The question comes to your mind that why is it so, why is it so? So to answer the question, to any of the question, is a research. And if you wanted to, if you are working on a prosthetic patient, and you are working on a prosthesis with the patient, and the patient comes to you that after wearing this device, I got a scar on the lateral aspect of my stump, then the question comes to your mind that why on the lateral aspect, why not on the medial aspect, why on the anterior aspect, and why not on the posterior aspect? So the answer to that question will be the research. So research is not something that is going that you have to go out of the way and you have to think like an Einstein. You have a simple question, a simple question that comes to your mind, and you have just to find out the answer to that question will be the research.
Okay, ma'am. The next question is, what is the motivation for pursuing this field?
I guess this session will be a great motivation. This session would be a great motivation for all of the students to pursue within this field. I guess if you have empathetic feeling within your heart that you want to work for a disability and you want to work for a disabled community and you want to give services to a disabled community, you uh, that will become a motivation itself.
Yes, ma'am. Now heading toward the comment section. The question asked by Noman in the comment section is, can I do internship after first year?
Yes, observership is allowed everywhere, but that will not be much useful for you because within first year we are studying the very basic subjects of the medical sciences like anatomy, physiology, biochemistry, and all this stuff. So observership or internship is only useful when you may have the basic knowledge of prosthetics and orthotic sciences. So I would suggest that after second year or after third year, you should go for observership or internship anywhere. And yes, you can do observership or internship anywhere within Indus. You can go for observership. You can go for observership in Pochi Foundation. You can go for observership anywhere. Nobody will you abandon you from doing observership.
Okay, ma'am. A question asked by Alina in the comment section is, can we run our clinic without an MBBS doctor participation?
Yes, exactly. Why not? Many of my colleagues or many of the students are like juniors are running their clinic on their own. Mm, but the only thing is that patient will be referred from anywhere like tertiary care. So you'll be needing the patient from from in tertiary care. You can run your own clinic. You can run your own clinic independently.
Okay, ma'am. No, before ending the session, kindly give message to the students.
Okay, the message to the students is that success isn't defined. Success is not anything that is defined like this. Reaching this point is means that you are successful in your life. Success is a name of continuous striving. You have to strive for better and the best every time in your life because there is no end. There is nothing is that yet you can say that is this is the end, this is the point that is the end of the story, and you get everything that you have planned for. There is there is a way for doing the best and that you consider that that this is the best. So keep striving, and only then you can get the best in your life, and you can make the best use of you best use of your capabilities. So don't waste your capabilities in just doing the mainstream thing. Think out of the box and keep striving.
Thank you so much, ma'am, for giving us your worthy time.
You are welcome.
Thank you, viewers. Hopefully, you all queries are answered. Now, this session is declared ended.